Thanks, Gio.
Thanks, Nakia. Hi, everybody. Me again. This is our annual fall open enrollment training. There's going to be a lot of content here. And the objectives are, one, before we talk about what to know about fall open enrollment and the important decisions that are made during fall open enrollment, I think it's always good to start with a refresher on Medicare basics. How to differentiate between original Medicare and Medicare Advantage, because that's usually, one of the big choices, one of the big decisions that are made during full open enrollment. Do I stick with original Medicare? Do I go to Medicare Advantage, or do I go from Medicare Advantage back to original Medicare? So it's helpful to really understand the differences between the two. Another objective is to help clients understand the changes that they make during the different enrollment periods, not just fall open enrollment, but other enrollment periods that are coming down the pike, like Medicare Advantage open enrollment period, and of course the special enrollment periods that exist throughout the year. And then we also want to cover Medicare COVID-19 coverage reminders, because these are reminders that folks should keep in mind while they make these decisions during fall open enrollment. So as I mentioned, we'll start with some Medicare basics, just a refresher. So Medicare is a federal program that provides health insurance for two sets of populations. One, people who have aged into Medicare who are 65 years or older. And if they're under the age of 65, they're eligible for Medicare if they've been deemed disabled by the Social Security Administration and they've been approved to collect Social Security Disability Insurance, SSDI. If they collect 24 months of SSDI, they are automatically enrolled into Medicare on their 25th month of SSDI. If they're under 65, they could also be diagnosed with the kidney failure specific disability, and that is another gateway into Medicare. There's no income requirements, so really the criteria is, as I mentioned above, person who's 65 years or over and is a U.S. citizen, or has legally resided in the United States for 5 continuous years, they're eligible for Medicare. If somebody's under the age of 65, if they've been diagnosed with ESRD, and they meet other criteria such as dialysis treatment or kidney transplant, they're eligible for Medicare. And if they're under 65, if they've been collecting SSDI for 24 consecutive months, those folks are eligible for Medicare. So once somebody becomes eligible for Medicare, once they obtain Medicare entitlement, then they start by default with original Medicare. Original Medicare is Medicare that's administered directly by the federal government, specifically by CMS, the Centers for Medicare and Medicaid Services. That's why everybody with Medicare starts with that original Medicare card, that red, white, and blue card. So everybody starts with original Medicare. Once they're in original Medicare, they do have the option to stick with original Medicare or go to a Medicare Advantage plan. And they can make that option when they first become initially eligible for Medicare. And if they want to make a change to whatever choice that they made during their initial window of enrollment, then they could utilize the most common time frame to do that is the full open enrollment period, which we find ourselves in right now. So as we know, Medicare is a bit of an alphabet soup. Part A, it covers hospital inpatient benefits. Keyword there is inpatient, meaning if somebody's at a hospital and at the emergency room, they're considered outpatient. So Part B is covering services there. Once they've been admitted as an inpatient by a physician with admission authority, then Part A kicks in and starts covering services. Part D is the prescription drug benefit of Medicare. And as we know, original Medicare red, white, and blue card only has space for Part A and Part B. There's no space for Part D. So anybody with original Medicare, if they want a Part D plan, they have to enroll into a standalone Part D plan. And as you probably have noticed, I skipped the letter. I went from A, B, all the way to D. So Part C is not really a different part of Medicare. It's just a different way of getting Medicare. This is the Medicare Advantage plan option. And the Medicare program calls it Part C. So we'll focus first on original Medicare. Original Medicare includes, again, Parts A, hospital insurance, inpatient hospital insurance. and Part B medical insurance. So outpatient services and if folks need to see a doctor or a specialist, Part B is covering those services. If somebody has original Medicare, again, drug coverage is available through a standalone Part D plan. So they have to enroll themselves into a standalone Part D plan. It does not cover certain services such as routine dental care. As we all know by now, original Medicare has some pretty lousy coverage of dental care. And hopefully something in Congress is in the works to change that finally after many years of original Medicare not really providing coverage for dental care. In terms of provider access, there is no network of providers under original Medicare. So an individual can receive covered services from any provider in the United States who accepts Medicare. So a person in New York who has original Medicare, if they stay in Florida for 3 months of the year, they don't have to make any changes to their coverage. They could just see an original Medicare provider in Florida without having to worry about any network restrictions. Also, original Medicare does not require referrals. So a person can see a specialist, cardiologist or any other specialist without having to go through a referral process. They don't have to gain a referral from their primary care physician. Now, in terms of cost, original Medicare does not have a limit or a cap on out-of-pocket costs. However, because there is no limit, original Medicare beneficiaries do have the option to enroll themselves into a Medigap plan. And we covered extensively Medigap plans and enrollment during last month's training. But folks with original Medicare do have the option to enroll into a Medigap plan to offset the cost of original Medicare. And in terms of cost, Part B premium this year is $140.50, and that's a premium that can be paid for by a Medicare Savings Program if folks are eligible in the state of New York. Part A premium is applicable for folks who do not have 10 years of work history, and the Part A premium gets pretty expensive. It's $470 about for folks who have less than 7.5 years of work history. But it's lower to about $269 for folks who have less than 10 years of work history, but more than 7.5 years of work history. But either or, it's pretty expensive nonetheless. There's also a Part B deductible that has to be met annually before Part B starts covering services, an inpatient hospital deductible. And in terms of co-insurance, we all know that for Part B, it covers 80% of the cost, and then the beneficiary is responsible for 20% of the cost. And of course, inpatient hospital and skilled nursing facility also carry with them a daily co-insurance. And as we covered during last month's training, Medigap policies or supplemental plans that pay part or all of the remaining costs after original Medicare pays first. So for example, Medigap policy can pick up the 20% Part B co-insurance. It only works with original Medicare, so a person with a Medicare Advantage plan, they don't have the option to enroll into a Medigap plan. It's only folks who have original Medicare. We've talked about the standardized plans last month, so folks want to know a little bit more about Medigap policies, I'll refer you over to last month's training and PowerPoint slide deck that was shared. And just a quick reminder that individuals newly eligible for Medicare on or after January 1st, 2020 are not able to purchase Medigap's Plan C or Plan F. Individuals eligible for Medicare before January 1st, 2020 are still able to purchase Plan C or Plan F. So it's only folks who become eligible for Medicare after January 1st, 2020 that are not able to purchase Plan C or Plan F in the Medigap policy world. So now we'll focus on Medicare Advantage plans. So Medicare Advantage plans includes Part A, B, and usually Part D benefits under one overarching umbrella, under one plan. It may cover services that are usually excluded from original Medicare, such as routine dental care, routine vision care, routine hearing care. However, in terms of provider access, beneficiaries within Medicare Advantage plans are usually restricted to a network of providers and facilities. So folks with Medicare Advantage plans, they just have to be mindful of the providers that they see, the facilities that they go to. They want to make sure that those are in-network providers, in-network facilities. And also most Medicare Advantage plans do require their members to obtain a referral from their PCP before seeing a specialist. And again, this is not something that's required under the original Medicare program. As I mentioned before, a Medicare Advantage member cannot purchase the Medigap plan, so Medigaps do not work with Medicare Advantage plans. However, all Medicare Advantage plans are required to impose a limit on out-of-pocket costs, called the maximum out-of-pocket limit, or the MOOP. And in terms of co-insurances and co-payments, these costs vary by plan. So every plan is different, and every plan has their own different cost structure. So Medicare Advantage plans must offer the same benefits as original Medicare Parts A and Part B. So whatever Part A and Part B is required to cover, Medicare Advantage plans are also required to cover. However, they can do so with different costs and coverage restrictions. So for example, beneficiaries required to get prior authorization for certain services that Medicare Advantage plans are required to cover. So this is something that original Medicare wouldn't require. But as long as Medicare Advantage plan is covering a set service that original Medicare is covering, then they've met their requirement. They can impose an additional barrier if they so choose. So in this case, the barrier would be getting a prior authorization. It can offer benefits not available in original Medicare. As I mentioned, most Medicare Advantage plans are now offering at least routine dental, routine vision, routine hearing care. But of course, it's always recommended for individuals to contact the plan directly in order to learn more about coverage specifics. So Medicare Advantage plans are now able to provide supplemental benefits. So plans can offer benefits that are not directly considered medical treatment, called supplemental benefits. Now this was something that was not really allowed under the Affordable Care Act, but policy did change to provide to allow Medicare Advantage plans to provide supplemental benefits a few years ago. Possible supplemental benefits include nutrition services, transportation for non-medical reasons, non-skilled in-home support like housekeeping, adult day health services, and of course benefits vary between plans and may not be available to everyone enrolled in the plan. So what that means is that MA plans can offer special supplemental benefits for certain members with chronic conditions such as diabetes. So it could treat its members within the same plan differently, and it can provide these supplemental benefits to distinct members within the same plan. And of course, the plan decides whether individual beneficiary would qualify. How you can help clients understand their Medicare Advantage plan benefits. The go-to should always be the evidence of coverage, or the EOC, which outlines the covered services, including supplemental and telehealth benefits. You can, of course, help beneficiaries carefully read plan materials or contact the plan directly to understand the full scope of covered benefits. And it's always very advisable that coverage of supplemental benefits should not be the only factor the beneficiary uses to choose coverage. Just because one plan is offering something like Meals on Wheels or something like that, that shouldn't be the ultimate factor that determines whether or not a person should choose this Medicare Advantage plan over that Medicare Advantage plan, or Medicare Advantage plan over original Medicare. Plans may have more variation. Two beneficiaries enrolled in the same plan may have access to different supplemental benefits. As mentioned before, this is because it's dependent usually on their health status, on their diagnosis, and also the plan design. So Medicare somebody in a Medicare Advantage plan, they still have to pay the Medicare premiums. So the Medicare program premiums. So anybody in a Medicare Advantage plan would still have to pay the Part B premiums on a monthly basis, $148.50. If they're not eligible for premium-free Part A, they still have to pay the Part A premiums on a monthly basis, And of course, there's the Medicare savings programs that can help pay the Part B premiums. And then there's the QIMBY level of the Medicare savings program that can help pay both the Part A and the Part B premiums. But somebody in Medicare Advantage plan would still be required to pay these original Medicare premiums. Then they could also be subject to a Medicare Advantage plan premium. And some plans do not charge premiums in addition to the Part B premium, but some plans do. Many Medicare Advantage plans, or some Medicare Advantage plans, can charge two premiums, one for the prescription drug aspect of the Medicare Advantage plan, and one for the health portion of the Medicare Advantage plan. So it could be that person's paying two premiums, and they usually pay it in like one bill, but it's itemized as two premiums, one going for the health portion and one for the Part D portion of the Medicare Advantage plan. But again, not all Medicare Advantage plans charge a health portion premium. Deductibles vary, by plan, and some plans may choose to charge a deductible. Some plans may choose not to charge a deductible. And of course, again, co-insurance co-payments vary by plan. So as I mentioned before, a person in a Medicare Advantage plan, they do not have the option to enroll into a Medigap plan. However, all Medicare Advantage plans are required to set a maximum out-of-pocket limit. In 2021, that limit is set by the federal government, $7,550. So that means that a Medicare Advantage plan cannot set their limit to their plans of more than $7,550. But many plans do set their limits less than the federal standard. So you can see Medicare Advantage plans with a maximum out-of-pocket limit of $4,000 or $5,000 or $6,000, so lower than the federal guidelines. And this maximum out-of-pocket limit is the maximum the beneficiary will pay in deductibles, co-insurance, and co-payments for the year. The limit is high, but when the person has met that limit, the plan actually just steps in and pays 100% of the cost of covered Part A and Part B services for the remainder of that year. And the maximum out-of-pocket limit will get reset at the beginning of the next year. Part D prescription drug coverage. And Nikki, I don't know if you wanted to stop, some segments for questions, or I don't know if maybe we should save for the end.
Yes, I think there's some questions. Hold on. Okay, so two questions. One is, will they receive yes, Michael, yes, you will receive a copy of the Medicare PowerPoint presentation by email, but I sent it also this morning and it's in your handouts. And someone wanted to clarify, if a client had Medicare prior to 2020, they can enroll now in Medigap Plan F?
Yes, that is correct. So if a person became eligible for Medicare before January of 2020, they are at liberty to purchase Plan C and Plan F. They are still being sold. It's just that a person that became eligible for Medicare after January of 2020 can't purchase those plans.
Awesome. That's all for the questions.
Awesome. Thanks, Akia. So we'll move right on to Part D prescription drug coverage. So Part D covers most outpatient prescription drugs, and the theme of the presentation is that every plan is different. So every Part D plan has their own formulary, the list of drugs covered by the plan, and every formulary is different from plan to plan. Beneficiaries should make sure that the Part D plan's formulary includes the drugs that they take. And a beneficiary can get Part D coverage in two ways. As I mentioned, if they have original Medicare, they can enroll into a standalone Part D plan. So with that standalone Part D plan, they will be provided a Part D plan card, and that's the card that they'll use at the pharmacy. If they have a Medicare Advantage plan, again, most Medicare Advantage plans do already include Part D coverage within that same plan. So usually a person in a Medicare Advantage plan will use that one Medicare Advantage plan card to use at their doctor's office, at the hospital, and at the pharmacy. But again, it's always very important. The main takeaway is that every Part D plan is different, every Medicare Advantage plan is different, and all the formularies are vary from one plan to another. So it's very important during, especially this time of the year, for folks to make sure that the formulary that they currently have is going to be the same as the formulary next year, because plans can change formularies year to year. So just because a person had a Part D plan, a standalone Part D plan this year, or a Medicare Advantage plan with Part D coverage this year that had the drugs that they were taking on the formulary, doesn't necessarily mean that it's going to be on that formulary next year, because formularies not only vary between plans, but also formularies change from year to year. So in terms of Part D costs, standalone Part D plans charge a monthly premium. The 2022 national base premium, so this is a national premium, it's $43.07. As I mentioned in the policy updates, the New York State average Part D premium benchmark is $42.43, but the national average premium is $33.07. Deductibles, some plans may have a deductible, some plans may have a zero deductible. Again, it varies between plans. And the maximum deductible is set by the federal government, so a plan can't impose a deductible higher than the limit that the federal government has set every year. I believe in 2021, it's $400. Coinsurance and co-payments, again, vary by plan and type of drug. So in terms of type of drug, many Part D plans use tiers to price drugs listed on their formulary. Drugs at lower tiers are less expensive, and drugs at higher tiers are, of course, more expensive. So this is a sample tiering structure that a Part D plan may utilize. So tier 1 would be generic drugs, tier 2 would be preferred brand name drugs, tier 3 would be more expensive brand name drugs, and tier 4 would be specialty drugs. And of course, tier 4 being the more expensive drugs on this sample tiering structure, and tier 1 being the most affordable drugs on this structure. So it's important that during follow-up enrollment, that this is also something that folks take into account. You know, when they go looking for their options in terms of prescription drug coverage, they want to make sure that the drugs that they're currently taking are on lower tiers and not on higher tiers, because if they're on higher tiers, then they're going to pay more out of pocket for those drugs. And if they're on lower tiers, again, it will be more affordable for them. Coverage restrictions. So Part D plans may have coverage restrictions on certain drugs. There are 3 types of coverage restrictions. First being prior authorization, where the plan requires the beneficiary to get approval from the plan before it will pay for a drug. Beneficiary's doctor can, of course, help in getting the prior authorization processed and approved, because usually beneficiary will need, medical support and physician support in order to get that prior authorization. There's also quantity limits. Plan can restrict the amount of drug the beneficiary can get per prescription fill, and step therapy, where a plan requires a beneficiary to try a cheaper version of their drug before it will cover the more expensive drug. So it's always very important during follow-up enrollment period for folks to see while they're looking for their options, if the drugs that they're taking have been imposed with such a coverage restriction like prior authorization, quantity limit, step therapy. They might want to look for plans where these restrictions aren't imposed on the prescription drugs that they're currently on.
Gio, before you move on to the next section, we do have a question.
Sure.
Nyla, sorry. Question is, do tier function like step therapy requirement, or if beneficiaries are willing to pay more for tier 3 or 4, they can if it's a covered drug?
So if there's a step therapy restriction, they would have to go through the step therapy restriction before that drug is covered. So if the drug that is at a higher tier is being prescribed and there's a step therapy restriction imposed, then they would have to go through the more affordable tier that the plan is requiring the person to be prescribed before they get to that higher, more expensive drug coverage. So it is still that the drug is being covered, or that it's on the formulary of the plan. It's just that the plan is requiring the person to first try out the more affordable drug, probably on the lower tier, before they get to a higher tier drug on their plan.
Great. Thanks, Gio.
No problem. Was that all the questions for now, Nikia?
Yes.
Great. So now we'll talk about making Medicare coverage decisions during follow-up enrollment. Important factors to consider. One of the more significant factors is provider choice. So as we mentioned, somebody with original Medicare can see any provider who accepts Medicare across the country. They don't have to worry about network restrictions or anything like that. Of course, somebody in a Medicare Advantage plan, they must keep in mind, if they're in a plan, as most plans do restrict their members to network of providers facilities, so they have to keep in mind about those networks before they see providers. So that's definitely something to consider when choosing a plan. If somebody has original Medicare right now and they want to maybe try Medicare Advantage next year, well, they should definitely see if the providers that they're currently seeing, providers that they currently like, accept those Medicare Advantage plans or in the network of the Medicare Advantage plans that they're looking at next year. So that's definitely something to consider. Out-of-pocket costs is also another significant item to consider. With original Medicare, again, a beneficiary usually pays 20% of the cost of Part B covered services and fixed costs for Part A covered services. But of course, the beneficiary does have the option to purchase a Medigap plan. And a Medigap plan can cover those gaps that original Medicare doesn't cover. So 20% or the deductible can be all picked up by the Medigap plans. However, Medigap plans in New York can get pretty expensive, and they have to pay a monthly premium to maintain that Medigap plan. So that's something to consider. Is a person financially capable to pay their Medigap plan premiums on a monthly basis? Medicare Advantage plan, beneficiary will usually pay a set co-payment. They'll have a plan card that would say right there on the card, $50 for a specialist, or $25 for a specialist, $10 for a PCP. So they'll know beforehand going in, how much their cost is going to be. But of course, a person in a Medicare Advantage plan, they don't have the option to go into a Medigap plan. So that's also something to consider. Important questions to ask. Does the beneficiary travel often? Original Medicare works throughout the United States. There is no network restriction across the country. And Medicare Advantage plans often have networks of providers. So if somebody travels often, maybe they should lean towards original Medicare because there's no network restrictions under original Medicare. But that is just one thing to consider. What types of insurance do beneficiary providers accept? Beneficiaries should make sure that providers accept the original Medicare or the Medicare Advantage plan that they are considering. What healthcare services does beneficiary need? Again, original Medicare does not cover certain items such as dental coverage, routine vision, and routine hearing care aren't covered under original Medicare, but most Medicare Advantage plans now provide some routine dental, routine hearing, and routine vision. So that's also something to consider, an important factor to consider when making a choice during follow-up enrollment as to choosing between original Medicare or Medicare Advantage plan. And also, what would be the costs associated with this plan? Beneficiaries should consider the out-of-pocket costs associated with the original Medicare, especially if they're not capable or considering to enroll into a Medigap plan. And they should also, of course, consider the cost of the Medicare Advantage plan that they're looking at, whether or not it has a maximum out-of-pocket limit and how much that limit is. As I mentioned, plans can set their limit up to the federal standard, federal limit of 7,550. But some plans impose a lower limit. So they, in terms of considering out-of-pocket costs, they may want to choose Medicare Advantage plans that have a maximum out-of-pocket limit that is much less than the federal standard. And again, very important, just a takeaway theme is that no two plans are alike. You want to find out the plan's rules before enrolling. It's always helpful to know if the beneficiary will have to see certain providers or get prior authorization for certain services. It's important to consider which plans do the individual's providers accept. Does the plan cover extra benefits such as dental cleanings or gym membership? Things that are important to the member. Does the individual want coverage for extra benefits? Is that something that that's going to factor into their determination of choosing a Medicare Advantage plan? Does the plan include prescription drug coverage? Some Medicare Advantage plans don't include prescription drug coverage. So, they just want to make sure that if they're choosing a Medicare Advantage plan, if they want everything under one overarching umbrella, there are many plans out there that include A, B, and D coverage under that one Medicare Advantage plan. But there are still some plans out there that only include health coverage and no prescription drug coverage. So they would have to enroll into a standalone Part D plan, or maybe they want a Medicare Advantage plan that doesn't have prescription drug coverage because they have credible drug coverage. Maybe they have a retiree insurance that provides credible drug coverage. So again, things to consider during follow-up enrollment timeline. And Part D plans also are not alike. So every plan differs from one another. Things to consider is, are the individuals needed drugs on the plan's formulary? Formularies vary between each other. So, just because one plan has certain drugs on their formulary doesn't mean that another plan is going to have those same drugs on its formulary. And of course, as I mentioned, formularies also change from year to year. So just because one formulary had certain drugs on it one year doesn't mean that it's going to be the same next year. So that's something to consider during this time. It's not only considering whether or not to choose a different Part D plan, but it's also important to consider whether or not the plan that a person is on currently is going to be the best plan for them next year. So folks should be receiving their notices, their annual notice of change. They should have already received that would inform them of any changes coming down the line next year. And those notices will tell them if there are any formulary changes of the prescription drugs that they're currently on. So that's a very important notice to read and to study during follow-up enrollment. Also important to consider if any of the drugs that they have are going to have restrictions. Again, there could be differences between plans that people are looking at right now, where one plan may impose a coverage restriction and another plan may not impose a coverage restriction on a certain drug. But there also may be changes in the current plan. So if a person has a current prescription drug plan without a coverage restriction, that plan could impose a coverage restriction next year. So again, that's going to be a determining factor of whether or not a person should stay on their current plan or should change their plan during follow-up enrollment. Tiers are also something important to consider, as I mentioned before, and also which pharmacies are in network or preferred by the plan. In-network or preferred pharmacies offer lower cost sharing, and it's usually recommended to contact a plan or use Medicare Plan Finder to get more detailed information about networks, about quantity limits, about coverage restrictions, and about formularies. So I think we're all pretty adept now to Plan Finder, and this was also covered during last month's training. It's a tool for professionals and beneficiaries to help folks enroll into or look for certain plans in their coverage area and also to enroll in those set plans. It can be used to compare Medicare Advantage plans and Part D plans, provides cost estimates and coverage basics. So it's a very, very, very handy tool that is being heavily utilized during this time of year. And this was covered during last month's training, so we could just move on. Are there any questions here?
I do not see any. I don't even see any hand raised, so I think you're good to go.
Sure. So now we'll move to making changes to Medicare coverage. So beneficiaries can make changes to existing Medicare coverage during the fall open enrollment period or the annual open enrollment period, as also referred to. And that started in earnest on October 15th. It's gonna run until December 7th. So folks can utilize the full open enrollment period right now. And any change that they make during full open enrollment is gonna be effective January 1st of next year. Another enrollment period coming down the pike, not too far away, is the Medicare Advantage open enrollment period. And this is for folks who come the new year, find themselves in a Medicare Advantage plan, and they could use this open enrollment period to either go back to original Medicare or choose another different Medicare Advantage plan. And then there are ongoing special enrollment periods depending on the circumstance. So folks who may have a extra help, they will have a quarterly special enrollment period for the first 3 quarters. They'll be required to use the full open enrollment period on the last quarter of the year. So if a person who has extra help wants to change their plan to become effective January 1st, they should be advised to use the full open enrollment period that ends October 15th. But those folks will also have a quarterly SEP starting in the new year. So they do have that added option. So that's another thing to keep in mind, for folks who are making their choices right now during full open enrollment period. If they do qualify for an SEP, that's also another option that they have down the line to make further changes. And also, again, the Medicare Advantage open enrollment period that is coming. Again, that's also something to consider for right now. And a beneficiary should contact Medicare to make changes during the full open enrollment period, the Medicare Advantage open enrollment period, and to use a special enrollment period. So as I mentioned, the full open enrollment period is currently underway. Started on October 15th. It's going to end on December 7th. Any changes that are made during this time are going to be effective the 1st of January 2022. And a person can make any changes right now. If they have original Medicare, they could go to Medicare Advantage. If they have Medicare Advantage, they could go from one Medicare Advantage plan to another Medicare Advantage plan. Also, full open enrollment is used by folks who don't have Part D coverage. So if they don't have Part D coverage, they could sign up for Part D for the first time during full open enrollment. However, if they do use full open enrollment to enroll into Part D for the first time, they may be subject to a Part D late enrollment penalty. Using full open enrollment to enroll into Part D for the first time usually means that a person missed their initial window when they first became Medicare eligible to enroll into Part D. And that's why it usually comes along with a Part D late enrollment penalty, which is 1% of the national base premium, and the national base premium is about $33. So it's 1% of $33 for every month the person went without Part D coverage when they should have had Part D coverage. And as a reminder, a person can decline Part D coverage if they have credible drug coverage. Well, credible drug coverage is coverage that is as good or greater than Part D coverage. But if they didn't have credible drug coverage, during the months that they either should have had credible drug coverage or Part D, then they will be subject to a Part D late enrollment penalty if they enroll for the first time during full open enrollment period. And again, very important to note that plan coverage and costs change every year. So again, just because a person's current plan is currently working for them and they really like their plan, doesn't mean that that plan is going to be exactly the same next year. A plan's network, Medicare Advantage plan network can change from year to year. So provider networks can change. Prescription drug plans can change from year to year. So a formulary can change from one year to the other. restrictions can be imposed on drugs that didn't have restrictions from one year to the other. And again, cost structures can also be changed from one year to the other. So again, it's very important, even for folks who weren't really looking to make any changes and like their current plan, it's very important during this time of year for them to really analyze the plan that they are currently on and to see if there's any changes coming down in the next year, to see if that plan that they're currently on still works for them next year, if it's still the best option for them next year. So really, it's important for everybody on Medicare, either a Medicare Advantage plan with prescription drug coverage, or if they have a standalone prescription drug plan. It's important for everybody to really take note of any changes coming down in the next year of their current plan, because then they'll have full open enrollment to make the changes that they need to change, that they need to make for the next year. And folks should also keep in mind that if they do choose a Medicare Advantage plan during the full open enrollment, which will begin on January 1st, that those folks will have access to a Medicare Advantage open enrollment period come January 1st. So if they're in a new Advantage plan in a new year and they don't like it off the bat, they have 3 months from January 1st through March 31st to either change to another Medicare Advantage plan or to go back to original Medicare and enroll themselves into a standalone Part D plan. So that's another thing to keep in mind. They do have a safety net. If they make any changes during full open enrollment period to go into a Medicare Advantage plan, they do have this additional window to kind of either correct their decision. A beneficiary should, when possible, use full open enrollment to make changes because the coverage will start earlier or start January 1st. Waiting until the Medicare Advantage open enrollment period means there's going to be a later start date. And a beneficiary can use the Medicare Advantage open enrollment period if they are satisfied with their current MA plan in the new year. So the plan that they chose during full open enrollment. As I mentioned, there are several special enrollment periods out there. These are periods during which beneficiaries can switch Medicare health and/or drug coverage outside of standard enrollment periods. For example, an individual with a Medicare Advantage plan has a special enrollment period to choose a new plan if they move away. I'm sorry, that was a typo. If they move away from areas served by a current plan. So a person moves, or they know they're moving, in the next few months, then they will have access to the special enrollment period for people who move from the service region. Another example is an individual with an MA plan has an SEP to choose a new plan if the current plan no longer offers coverage in their area. So some plans may pull out of certain areas or close entirely. So those folks will have a special enrollment period that is more extended than the full open enrollment period to make their choice to change their plans. The start and end dates of each special enrollment period are specific for each SEP, and we do have a pretty handy flyer that I could share with folks about all the special enrollment periods that are available, when they start and when they end. Okay, any questions?
I don't see any questions in the question box. If you have any question, if you want to raise your hand. No questions, Jill. I guess you can move on. Oh, wait. I see one. Oh. Hold on. Oh, yes, Nate, we can send the flyer on the SCPs in the follow-up email. But you should be able to use the link in what we, inside the PowerPoint. If it doesn't work, just let us know.
Yeah, definitely. That's the link to the Medicare.gov SEP chart, but I will send over our actual flyer as well, which I think is more friendly.
Thanks, Gio.
No problem.
And thanks, Nate.
So now we can talk about some COVID-19 and Medicare coverage reminders. And again, these are important reminders for folks who are making important choices during fall open enrollment period about COVID-19 and how Medicare covers COVID-19 related services like testing and vaccines. So coronavirus testing is covered under Part B as clinical laboratory tests. There is no cost sharing for COVID-19 testing and associated visits. So no cost sharing means no deductible, co-insurance, or co-payment. And this applies to both original Medicare and Medicare Advantage plans. So folks who are choosing between original Medicare and Medicare Advantage plan, they should just know that regardless of what they choose, COVID-19 testing will have no cost sharing associated with it. And as you can see there, Medicare Advantage plans can now require prior authorization for testing provided after March 17, 2020. The coronavirus vaccine, also covered under Part B, whether the beneficiary has a original Medicare or Medicare Advantage plan. Also, just like testing, there is no cost sharing for vaccine. And again, this is regardless if a person chooses original Medicare or Medicare Advantage during fall open enrollment. So they really shouldn't be worried about, what the coverage is going to be for COVID-19 testing or vaccines during this time of year. They should just make their choice the best fits their needs without having to worry about if Medicare Advantage is going to cover this or if original Medicare is going to cover that, because both are covered without cost sharing. Telehealth services are provided during a full visit with providers using telephone or video technology that allows for both audio and video communication. Limited services can use audio only, including some behavioral health care services, but these are limited in scope. If a beneficiary has any questions about technology requirements for telehealth services, they should ask their provider. However, during the public health emergency, telehealth services are covered under Part B throughout the country, in healthcare settings, and at home. Standard cost sharing may apply, but provider can choose not to charge the beneficiary for cost sharing. So this is the provider's discretion to, if they want to. It is the Centers for Medicare and Medicaid Services has encouraged providers to not charge for telehealth cost sharing. But again, it's at the provider's discretion. Provider usually cannot routinely waive cost sharing because that violates anti-kickback rules. But again, it's up to their discretion whether or not they want to impose cost sharing for telehealth services. If the beneficiary has a Medicare Advantage plan, they should contact their plan to learn about its costs and coverage rules. So just to review, and we could save some time for any additional questions. In terms of helping clients choose how to receive Medicare coverage, choosing Medicare Advantage, original Medicare or Medicare Advantage plan is a personal decision. You can definitely help clients weigh their options based on their healthcare needs and financial situation. If a client isn't happy with their selection, they can use full open enrollment to change their coverage right now. But they could also keep in mind that Medicare Advantage open enrollment period is not too far away if they want to disenroll from their Medicare Advantage plan, enroll into a new Medicare Advantage plan, or re-enroll in original Medicare. So they do have that backup, that safety net that is starting on January 1st, depending on what choice they make during full open enrollment. So we learned a lot today. We did some Medicare refreshers, some Medicare basics, main differences between original Medicare and Medicare Advantage, Medicare enrollment periods, such as the full open enrollment period, the Medicare Advantage open enrollment period, and the special enrollment periods. And the important factors the individual should consider when making decisions, between original Medicare, Medicare Advantage, or between prescription drug plans during this very important time of the year. And we wrapped up with Medicare coverage reminders for COVID-19 that people should keep in mind when making those decisions. So that actually wraps up the training, and we have a few minutes to spare, so we could definitely answer any questions folks may have.
Yes, Gio, we actually have a couple of questions that came in. The first question is, if someone spends 6 months in another state, could they technically use an SCP to change plans for 6 months and then again when they move back?
So if a person moved, so the moving SCP, and I don't know that off the top of my head, but there is a time limit for the special enrollment period for people that move, and I believe it's 2 months, and it starts when the person notifies Medicare, or when Medicare itself is notified, whichever comes first, that the person has moved. And then the person has 2 months from that date to choose another plan. So I don't think that this would apply. So if a person, waited more than 2 months and moved 6 months ago, doesn't seem like they would have access to this SCP.
But what about those who are like snowbirds? They spend 6 months in New York State and the next 6 months in Florida.
Oh, I see. Yeah, I mean, they definitely could, they definitely could have access to the SCP in twice in 1 year. So when they move to Florida, they would want to choose the plan that is in the coverage area, and then when they move back to New York, they'll have that SCP again to choose a plan in that coverage area, which is what would be advisable, because it wouldn't be advised for them to use the coverage that they had in New York when they moved to Florida. Because again, the SCP is really only a 2-month SCP, according to when CMS is notified of the move. Every plan does have a coverage area, so it would be beneficial and would be advisable for folks to ensure to make changes to their coverage when they do move, if they're moving for more than 2 months, if they're going to stay at a certain state for more than 2 months.
Okay. And do you know of any like Medicare Advantage plans that provide services in both states? I'm guessing like Empire. I know Empire is one of those states plans that usually have like a coverage extension for individuals who.
Yeah, that's a good question. I don't know the answer to that, but I can definitely look that up.
Okay. Great question.
Good question.
Another question is, so someone wants to confirm both antigen, the quick, and the PCR, longer time testing, are not subject to any cost sharing, correct?
Yes. Antigen and PCR, yes, that is correct. I could double check, but to my recollection, yes.
Okay. And what about the antibody testing? That would be subject to cost sharing.
Yes, that definitely I know is subject to cost sharing.
Okay. Great. Awesome. So that was all of the questions in the question box, but if you want to ask a question, please raise your hands, or at least let us know that you're typing in your question in the question box so that we can wait for you. So Kenny, Gio, I don't see any hand raises or any additional questions.
Great.
So I think we can wrap this up.
Awesome. I'll send you the flyer, the SE flyer, in case you could share with the group.
Yes, great, awesome. And if you have any case questions that come up after today, you can always reach out to Geo. We will also send you Geo information. Oh, wait, a question came in. Let's see. Oh, no, they just saying thank you, Geo.
No
Thank
problem.
you
My
for your
pleasure.
participation. So that concludes our meeting for today. If again any question rises after we end today, please feel free to reach out to me, Diane or Catherine, and we'll see all of you next month, or virtually anyway, next month. Thank you, everyone. Have a blessed day.